Assalamualaikum warahmatullahi wabarakatuh. Today our group will present about infertility. Before we start, let me introduce the members of our group, which is Sharifah Zainab, Nur Amni Ifah, Anis Batrisha, and Farah Najiha. Firstly, what is infertility and what causes it to happen? So, infertility is a disease of the male or female reproductive system defined by the failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. It happens because of many factors like lifestyle, such as smoking, obesity, or stress, age, or even medical problems like low sperm count and polycystic ovarian syndrome, or known as PCOC. The graph shows the fertility rate in Malaysia from 1958 to 2022, indicating the rate has dropped significantly from above 6.0 to just 1.63 in 2022, well below the replacement level of 2.1. The decrease of fertility also reflects a growing concern, which is the rise of infertility cases in Malaysia.
Moving to the next part. So, what is our chosen treatment? There are various treatments used to overcome this issue, but our chosen treatment is in vitro fertilization or IVF. For the IVF procedure, first thing first is pre-treatment evaluation. These include medical assessment, lifestyle modifications, and counseling. For medical assessment, ovarian reserve testing, semen analysis, and screening for infection disease. For lifestyle modification, advising on diet, exercise, and supplement to optimize fertility. And lastly, for the counseling, discussing the IVF process, expectation, and emotional support. Next step is ovarian stimulation. These include hormonal therapy, monitoring, and trigger shot. For hormonal therapy, administration of medication like FSH to stimulate multiple egg production. Then, for monitoring, regular ultrasounds and blood tests to track follicle. And for the trigger shots, injection of HCG to mature eggs before retrieval. The picture include the parts of where injection can be done. Moving to the next procedure, which is egg retrieval. Egg retrieval is oocyte pickup. The procedure is a minor surgical process performed under sedation to collect eggs from the ovaries, and the technique using is transvaginal ultrasound, which is guide aspiration using a fine needle. The fourth step is sperm collection, which is sample collection typically through masturbation on the day of egg retrieval, and for the process, sperm washing to select the healthiest sperm for fertilization. Next step is fertilization. These include conventional IVF and ICSI. For conventional IVF, mixing eggs and sperm in a lab dish to allow natural fertilization. And for ICSI, direct injection of a single sperm into an egg used in case of male infertility.
Next step, embryo culture. For development, monitoring fertilized eggs as they develop into embryos over 3 until 5 days. And for assessment, evaluating embryo quality and selecting the best for transfer. Next step, embryo transfer. We have to place the selected embryos into the uterus using a thin catheter. And for timing, typically perform 3 until 5 days after fertilization. Next step, post-transfer care. For medication, using progesterone supplements to support the uterine lining, and for monitoring, watching the signs of implantation and managing any side effect. And for the last step, which is pregnancy test, timing conducted approximately 2 weeks after embryo transfer, and for the method, blood test to measure HCG levels indicating pregnancy.
Next, we will talk about fatwa regarding IVF treatment. Artificial reproduction is not mentioned in the primary sources of Sharia. However, when procreation fails, Islam encourages treatment, especially because adoption is not an acceptable solution. Thus, attempts to cure infertility are not only permissible but also encouraged. The duty of the physician is to help a barren couple achieve successful fertilization, conception, and delivery of a baby. All assisted reproductive technologies are permitted in Islam if the semen source, ovum source, and the incubator itself, which is the uterus, come from the legally married husband and wife during the span of their marriage. According to Islam, a man's or woman's infertility should be accepted if it is beyond cure. Assisted reproduction was widely accepted after prestigious scientific and religious bodies and organizations issued guidelines which were accepted by concerned authorities in different Muslim countries. This is the video on how IVF works and the procedure involved.
The first step is taking fertility medications in the form of shots to help your ovaries produce several mature eggs. The goal is to make 10 to 15 eggs. It takes about 2 weeks until your eggs are ready for retrieval. The retrieval process is a 15 to 30-minute procedure. The doctor uses an ultrasound to put a thin, hollow tube through your vagina and into the ovary that holds your eggs. The needle is connected to a suction device that gently pulls the eggs out of each follicle. Now comes the part everyone's most familiar with: combining sperm with your best eggs. In IVF, the egg and many sperm are left in a laboratory dish to fertilize on their own. The fertilized egg then divides its cells until it reaches the blastocyst stage 5 to 6 days after fertilization. Multiple embryos are then transferred back into your uterus in the hopes that at least one will implant itself and begin to develop.
In conclusion of IVF for infertility in Malaysia, infertility affects many Malaysian couples due to medical, lifestyle, and age-related factors. IVF emerges as an effective solution, addressing issues like blocked tubes, sperm disorders, and unexplained infertility with a 30 to 40% success rate. Islam permits IVF when using the couple's own genetic material, as affirmed by Malaysian fatwas. The Quran reminds us, Allah grants children to whom He wills, from the translated verse of Surah Ash-Shura, verses 49 to 50, positioning IVF as an ethical means within divine will. To sum up, IVF offers hope for parenthood while respecting religious boundaries. May Allah ease the journey of those struggling with infertility.
Next, here is our references. That's all from us, and thank you for your attention.